Layering vitamin C. I did a complete video on vitamin C called the Vitamin C Tutorial, but many people wanted to know a simple way to think of with layering. Now, the first considerations are the product, the type of product you're using. Most people will be 10% or above. Mine is 20%, and it's more of a cream, a lotion. It could be your final step. For many, they're using a serum, so a full serum, like a dropper type. Doesn't matter which one you're using, but it will matter a little bit in layering. Keep in mind when you're storing something like this, you want to avoid sunlight. With all skincare, I want to avoid extremes of temperature, but particularly a warm environment. So if you're in a cool environment and there's not a lot of light near your window, you could keep it near the window to keep it cool. However, you might want to keep it in its packaging and check the packaging. If no light can get in, that's fine. But you want to keep the activity of the product, because for many, they want L-ascorbic acid or something very close to it, and that's not the most stable form. Vitamin C is not the most stable product, and the nice part is you're going to be going through it, hopefully, every 2 to 3 months, because it's a staple. Where do we apply it? Full face and neck. Everyone forgets about the neck. The under eye is great, and a lot of people can tolerate it a little bit on the upper lid, because we need to remember what it does. It brightens the skin, it helps prevent sun damage, and it helps reverse the appearance of brown spots, fine lines, wrinkles. It's an antioxidant, and for many, it can help with acne, although this is less well known and studied. So let's go to the layering part. So the first thing, cleanse the skin. Now, if someone has acne prone skin, for sure, a salicylic is fine before using vitamin C. If someone's using benzoyl peroxide, I don't like mixing those two. If you're at that point with your acne, probably a vitamin C isn't something you want to be using until the acne is under control. But the salicylic wash is fine, and often for people with mild to moderate acne, that's enough to keep at bay. For most, you want a little bit of a moisturizing cleanser. So when the skin is cleansed, now it comes down to, if you have a full serum, like in a dropper form, the best absorption is going to be your first step. Leave the skin moist and apply it. I like to wait 3 to 5 minutes, so people will brush their teeth or do something in between before applying their next layer, if they're going to apply the next layer. For a serum, most people are going to want a next layer because it is not that moisturizing. A lot of times you're going to find hyaluronic acid in a serum, and that's going to want or need water for the hydration. Mine's more of a lotion type, and several people make it. I have vitamin C's from other companies, and they are more moisturizing. I tend to like that better because you can put other products and things that hydrate the skin within the ingredient list. And you don't need anything else layered on top, especially if you don't need sunscreen, if you're not being exposed to the sun. So vitamin C, like I have, might be your final and only layer of applying C. And the beautiful thing is you can apply C to the whole face. So unlike a retinol where you might use at night because you're not putting it in certain areas, for some the neck and the under eye are sensitive. If the serum is what you're using, afterwards, at least something moisturizing can go on top. Most people are using a vitamin C in the day, so using a retinoid is not really something that people ask about. They'll use the vitamin C in the day, serum followed by a moisturizing component. That could be a ceramide, something as basic as a ceramide product, your favorite moisturizer, or even just a moisturizing sunscreen is fine as a final layer. People ask here in the morning very commonly about niacinamide. And if you're using a straight up niacinamide, it's absolutely fine. For my patients, they're going to be using the anti-age growth factor, which is a serum and an accelerator. Within the serum is your niacinamide. And that's absolutely fine to place after a vitamin C. So that is a very asked question. And of course, your final step is always going to be your sunscreen. For those using acids like azelaic acid, the reason you can do this partly is because your vitamin C should be a lower pH. If you're on a good one, it should be a lower pH. So it works well with acids, and you can put either on first. Most commonly, it's going to be a vitamin C serum, followed by your azelaic, followed then by a moisturizer or sunscreen. The benefit of putting it on in the morning, of course, there is that data saying that it's sun protective, but it's one of the most common products used because it's one of the most effective, and I like it with vitamin E and ferulic built in. I hope that helps you layer your skincare. I put a complete video up here on the vitamin C. What do you use? What's your favorite vitamin C? Stay tuned, like this video, keep your skin and body beautiful, healthy, and vibrant.